Well, hello everyone. I'm the director for our New Zealand not-for-profit registered educational charitable trust called Common Knowledge. We've been around since the 90s, and I brought 25 years of skills that I had developed in the 70s with hundreds of mothers and fathers, and now thousands of birthing better families into a charitable organization when I immigrated to New Zealand. And we focus on online birthing classes of skills that mothers and fathers developed, as well as a concept. And that concept was developed in the 70s when this concept could have blossomed, which is a societal concept that when pregnant, it's just normal and natural to self-learn birth and birth coaching skills, and then use those skills to work through the activity of birthing your baby. No matter where your birth occurs, no matter who's present, no matter your circumstances or beliefs, no matter your choices or lack of choices, or your change of choices, or what happens to or around you. Because birthing better families are absolutely committed to the idea that we get pregnant to have a baby, not a type of birth, and it's a one-off activity that each woman has to do with her baby, no matter the circumstances, and when we are skilled, we just do that activity better. So back then in 1970s, there was only a 4.5% cesarean rate. So basically mentally we were thinking, okay, we're going to use skills to cope with the natural and normal occurring pain of labor contractions. Yes, multiple millions of us learned Lamaze and the Bradley method, and those skills worked for some of us, but they were targeted to low-risk women with the goal of having a natural birth, pain-free labor, and no medical interventions. So there's that word pain-free. And this talk is about pain in childbirth. I've been at hundreds and hundreds and hundreds of births, seen hundreds and hundreds and hundreds of birth professionals practice, listened to stories of many thousands of birth stories from women around the world and from fathers. And this is what I've learned over all those years. And as the director of a not-for-profit, this is what I want to share with you. It is rare as hen's teeth that pain in childbirth is connected to a problem. And I'm going to repeat that again. Rare as hen's teeth. Now let's distinguish between laboring births first, so the natural and normal occurring pain of labor contractions, and surgical births as cesareans. So of course, there are pain issues that may be a problem when a person is recovering from surgery. We understand that. So let's just at the moment talk about labor pains. The only problem that I know, and I am not an expert, I have no medical training, don't rely on me, ask your care provider, go to another professional. The only pain in childbirth that I know that is associated with a problem, and it is a problem, is when the placenta separates in labor. It's called an abruptio, and a woman bleeds into her uterus. The uterus fills with blood, and that expansion of the uterus causes intense pain. That is, in my experience of 50 years, the only pain problem that is associated, the only pain in labor that is associated with a problem. However, most men who are in labor, when they lack skills and they see their partner in pain, believe there is a problem, and it frightens them. They think and they say, how can somebody be in that much pain without there being a problem? For women in birth, it's different. When women are experiencing pain in labor, they don't often think that this is a problem, but they sometimes do, but they just do not like it. Now, this is what the reality of our human history is. There has never been a concept until the 60s with Lamaze and Bradley that any woman can have skills to cope with the pain of labor contractions. Because around the world and throughout time, we do not know what our birth is going to be like. And therefore, societally, in our thousands and thousands of societies, we actually didn't develop skills to cope with the pain. And that left women suffering. We've all heard that expression. Women suffered in childbirth. That has never meant that there is a problem. It meant that women don't cope with the natural and normal occurring pain of labor contractions. Lamaze and Bradley and Grantley agreed with the first people who were saying women can cope if they use breathing and relaxation skills. They were the first skills-based methods, and they were universal. And yet at the same time, they focused on low-risk women, they focused on natural birth, pain-free labor, and no medical interventions or no medical assessments, monitoring, and procedures. And that was a flaw. It's been a massive flaw in hindsight. Had they said 100% of pregnant women are going to give birth, because that's true, one way or another, no matter where, no matter who's present, no matter the woman's circumstances or her beliefs or her choices or lack of choices or change of choices or what happens to her around her, each of us as women who are pregnant, we are the only ones doing the activity of birthing our baby. And you would think that our human mind would go, it's an activity. Humans love to be skilled for activities. Let's develop skills to do this activity. But we didn't. And when the first skills-based methods arrived in the 60s, in my lifetime, they weren't great. They worked for some, didn't work for many. They put a lot of people off because they weren't directed to anybody who had medical risks. And when this natural birth or this labor wasn't pain-free, people stopped using the skills. So birthing better, the families that developed birthing better, that's the first thing we focused on, was how to cope better and how to work and manage it. And so fathers and mothers, we have the same body. We blink, we cough, we can tighten up our rectum. We all respond to pain very similarly. So when we're talking about pain in childbirth, it is different than the rest of pain in life. And this is where it becomes incredibly complex conversation. How many of you have had a toothache that lasts for days? How many of you have back problems that last for days? How many of you other people are dealing with chronic pain or have had acute pain? How many of you? And how many of you have just had to endure it and cope with it? Lots of us, for goodness sakes. Yet how many women who give birth are terrified of labor pains and who just quickly will use an epidural? My generation didn't have epidurals, so we were given other pain relief. My mother's generation, we were all knocked out because that was the belief in modern society that modern medicine should save us from having pain, along with dying from infections, so antibiotics, along with dying from childbirth illnesses and other illnesses, vis-a-vis vaccines. Why do you think during this COVID period there has been such a stress on the medical community rather than just letting people die? When you hear people say COVID's a phony, it's just like the flu, well, take away healthcare. If you have diabetes, take away your medication. If you have a heart problem or cancer, take that away. Take away the medications. What happens? People die. So in life, when we have pain, outside of childbirth, life pain, just pain in life, is connected to a problem. And we hope it doesn't become a tragedy. But in childbirth, in labor, and we're just talking about labor at first, that natural occurring pain is connected to the opening up of a part of our body as women we can't see, which is our cervix. How tightly closed is our cervix? Tighter than our rectum. Okay, so our cervix is very tightly closed, because it can't really have much give because it keeps our baby safe inside so it can grow. So when our trust talks to pregnant men and women about labor pain, because fathers and mothers develop these skills equally, we had to equate the dilation of the cervix from that to that, and the pain associated with the retraction of that very tight connective tissue, 50% connective tissue cells, 50% muscle cells in that cervix. That has to dilate to that much through contractions. And fathers got it. It was simple. If an object this big were coming through the hole in their penis, it would hurt, but they could see it. And they would know this isn't a problem. They would know it's a process. So the labor pains are a process. There is pain associated to that process, which means if it's not a risk, and it's just not a risk, and that there's no risk, so therefore no risk is going to become a problem. And therefore, if there is no risk, there is no problem that can come from no risk, and there can be no tragedy that comes from the problem. So the natural and normal occurring pain that we as women experience as our uterus is tugging open and retracting this very tight muscle and connective tissue organ, the cervix in our body, is a process. And we know it. As women, we know it. First of all, we know it because we can have Braxton Hicks contractions that can have a little pain or not. Then we can have what's called prodromal labor, which some women call false labor or fake labor, which it's not. It's the baby in our body flooding our body with hormones to soften and make it more mobile so that when our body does the hard work, the labor part of tugging open the cervix, it can be done efficiently. However, this early prodromal preparation can have pains associated with it. And how we as women explain labor, active labor, when the uterus is actively opening the cervix at a defined time, 1 or 2 hours, there's a change, there's a progression, that the beginning part of that activity, the contractions aren't very painful. So we have to imagine why. Because this cervix, which hangs down for about an inch, is beginning through these contractions to thin out, to become even with the top of the vagina or the bottom of the uterus. And those contractions don't often have much pain associated to them because the hard work of dilating this cervix has not yet occurred. So as women, we articulated by saying, I know I'm having a contraction, but it's not very painful. And therefore, I can cope. That's what we hear. Thousands and thousands and thousands and thousands and thousands of birth stories. Beginning of my labor, the contractions weren't painful. So I went about my business or whatever, right? Then as the cervix, and we don't know that because no one has said to us, it's okay to stick your finger up your crotch and feel for change. It's okay to do that. We do that to retrieve tampons, for God's sakes. Our partners digitally go inside us. Yet in pregnancy and birth, it's like a taboo. But why should it be? It's a skill. If we can feel inside and feel change, then we can attribute the sensation changes to what's changing in our body. And that grounds us and helps us cope better. So when we get to be about 3 centimeters, and if you feel inside, you may not even be able to feel the cervix because the cervix is actually our pubic bone is like this to the front, And when we stick our finger in there, you can't feel very far back. And the cervix is in the middle, and 3 centimeters isn't very much of what can be 10 centimeters. So we may not even be able to feel the arc of the cervix, but we can feel the thin part of the tissue. But at 5 centimeters, we can feel that arc. 6, 7, 8, 9, 10, the cervix is back in our pubic bone. We can feel that. So as our labor contractions effectively work to dilate and retract the cervix, the pain increases because this tissue, this ring of the cervix that has been so tight, has to stretch. And we're going to have an equate this to something else. Have you heard of the ring of fire? That's when this is sitting on the outlet of our vagina, and that tissue is stretched. And when we stretch that tissue and it's tight, it hurts. So let's give an analogy in life. Would it hurt your tissues to stretch to do a full split? Duh. And that's why men would say, if this was coming out the hole in my penis, it would hurt. But I'd see that it's not a problem. So it is not a problem when you have the natural occurring pain of contractions. And as the cervix dilates more, the pain increases. Thankfully, once the baby moves through that tight ring into the top of the vagina, the contractions change to push the baby out, and the next real pain is when the baby stretches the outlet of the vagina. So usually pushing feels very good. So we have to understand that labor pain is natural, it's normal, it's occurring, and it is not related to a risk. It's not no risk. It's not related to a problem because there's no risk, and it's not related to a tragedy. And if I'm incorrect, make a comment. We know an abruptio, when the placenta separates in labor, is connected to pain. That is so rare. And it is shown by the uterus expanding. And in the medical world, they would be taking your blood pressure, they would know something is wrong, and they would respond to that. So you cannot just be afraid of anything, because there are so many risks in life, so many problems in life, that so few of them end up in tragedy, yet none of us get out of life alive. And many of us experience acute pains and chronic pains, and we live with them. Some of us even mature and have more endurance and more resilience because of our pains. But in childbirth, we are very, very, very easy for us to go, nope, not for me. I'm going to just have pain relief. That's okay from our trust viewpoint. We don't have any judgment about that. However, we need to say to you that the reason that's occurring is that there is no societal message at all that when you're pregnant, it's normal and natural to self-learn birth and birth coaching skills and then use those skills to cope, to manage, to work through, to deal with, to handle, to stay on top of, and feel in control when you have the natural occurring pain of labor contractions. Because when a contraction ends, usually the pain goes away. Now, yes, there's a caveat. If you have back labor, the back labor does not go away. But back labor is not a problem. It's an indication that your baby is a tight fit into this bony structure. And if you had skills, you would know how to mobilize your sacrum, and you would know how to create space side to side between your big hip bones. But instead, We as women have inaccurately told other women that the way to deal with back labor is to press on the sacrum, which feels better to the woman, but it compresses the space of our baby and it causes our labors to linger. So instead, we want to create space in our pelvis. Since there's no societal message at all that anybody becomes skilled, we are sitting there as a trust for 50 years, a half a century, saying to people there are skills to use to cope with pain and to work through some of these problems like back labor. And why has our voice not been heard? Because these three obstetricians, Lamaze, Bradley, and Grantley Dick Reed, started a conversation that said low-risk women should use these skills in order to achieve these three goals, of which one of the goals was to have a pain-free labor. And it's really hard to have a pain-free labor. I've been with a handful of women who have experienced no pain in labor. Good on them. I've been with many more who find labor manageable, and I have been with multitudes who manage pain because they use skills. And they don't have to like the pain. They can hate it. I hate labor pain. I hate it. I have quick, very intense labors. They're overwhelming, and I use skills to cope with the pain, while one part of my brain goes F, 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 as a contraction occurs. I don't have to like it. I just have to manage it. But because I know now, because families, men and women, develop the birthing better skills, every time the labor pains would get more intense, I'd check myself. And I could feel change. And so I knew why that pain was getting more intense. Still didn't like it, right? So we have to understand that the childbirth pain is productive pain. It's going to last for X amount of time, and it's going to be over with. No, we do not forget what the pain's like any more than we forget the pain of a toothache or breaking our leg. We just can't bring that pain up again. But if we break our leg again, we have it. If we have another toothache, we have it. If we have another labor, we have it. So you need to understand that childbirth pain is productive. All of us can have skills to deal with just that productive part of labor pain, but birth skills that deal with the productive part of labor pain can deal with any pain. Why not? Why not know how to breathe and to relax your body? Why not know how to expand into that pain, see if it helps, right? Or how to specifically soften in that pain location to see if that helps. Why not just use those skills so that you can work through and manage the pain? So if people want to use epidurals in labor, that's fine. If people want to use pain medication to have a toothache, that's fine. And it's great to have skills to continue to work through the pain. And labor pain is more finite than a toothache pain or a pain of having broken a leg or back pain, or having back problems or neck pains. So when we're dealing with labor pains, we need to change the societal message. And we've tried for 50 years. At first, we came up against the small natural birth movement, but it was powered by Lamaze and Bradley and Grantley Dick Reed that low-risk women should use these skills to achieve a natural birth, pain-free labor with no medical interventions. If they had said 100% of pregnant women should use skills so that we can reduce the human suffering around childbirth pain, we actually achieved that, just nobody saw it. They saw it individually because multiple millions of women and men in the United States used those skills and achieved that. We reduced the suffering. We knew we had pain, but we felt better about our births. We didn't have the shame, blame, guilt, disappointment, anger, frustration, and birth trauma that the generation of women have now because they have such a high expectation of what they want at their birth. Because really the childbirth movement began in the 1980s, and it became global, and it became fixed with a philosophy. And that philosophy has led us as women, and it was a women-led philosophy, into not having a societal message that we need skills for birth. We can all agree. So let's start with an idea. Okay, the idea is that pregnancy and childbirth are normal life events. We can all start with that. We know some women have IVF. That's okay. It's still a normal physiological life event. We can all agree with that. But this is where it splits. The natural birth movement that became what it is today says that natural occurring pregnancy and childbirth rarely require medical care. That's not accurate. Non-pregnant women who could have babies need medical care for lots of lots of stuff. And when they get pregnant, those issues can still be there. Or people without issues can develop issues, and babies can develop issues, and in birth more issues can occur, more risks or problems can occur. So that tag on is incorrect. Pregnancy and childbirth are normal life events that can or cannot include the need for any type of health care. So the natural birth movement moved along from rarely require medical care, which meant that the natural birth movement continued with the belief that low-risk women should then have choices, create a birth plan, to say no to medical interventions or medical assessments, monitoring procedures. So if you tweak that rarely requires medical care to say it may or may not require any health care, then this other pathway would come along that would say, first of all, let's prepare our bodies for birth while we're pregnant. Let's make it just normal and natural that we learn some skills. And we learn some skills in order to cope. Because the two elements of childbirth have always been suffering, which has nothing to do with a risk, a problem, or a tragedy, and everything to do with the natural and normal occurring pain. So had those three obstetricians, had the natural birth movement said, we want to bring skills along with choices. And the reason we want to bring skills is we like the fact that women aren't suffering anymore with the hard labor, the hard yakka, the hard work of coping and managing with the natural occurring childbirth pain, which is not a problem, which does not require medical care. Had they said that, I wouldn't be talking today. Okay, so way back then, when we started talking about this and said pregnancy and childbirth are normal life events that may include health issues or financial issues or psychological issues or substance abuse issues or abuse issues, everything it is included in that. And that birth, at that point it was labor, because 95% of us labored, that we need to have skills just to deal with the natural occurring pain, that we should be able to cope and manage, and our partner's role should be able to coach us and help us. In fact, Bradley method was called husband coach childbirth. So in fact, for an inkling, we had the possibility of growing a skilled birthing population where it became normal and natural in pregnancy to self-learn birth skills and use those skills to work through the activity of birthing your baby. But because back then low-risk women were peeled off and everybody else was left to flounder, and the natural birth movement of the 80s continued to focus on low-risk women, saying no to medical care, and they didn't focus on the natural occurring pain because philosophically they actually said, because pregnancy and childbirth are normal life events and it's a physiological thing, therefore women know how to do this. No, oh my God. And this is what was crazy back then and remains crazy today. So let's look at physiological things beside birth. How about being horny? I mean, we get randy. We want to have sex, right? We just want to do it. And we want to do it not related to procreation. We just want to feel good and have sex. Because we get horny, do we know how to be a good lover? Oh, come on. We don't. We have to learn skills, and then we have to apply the skills. And usually, unless you're into S&M, sex is usually pleasurable, not painful. And even if we're good lovers, we don't continue to have sex for 3 hours or 9 hours or 12 hours or 24 hours. So the physiology of being horny is the same driver as the physiology of giving birth, except we have sex more often than we give birth, right? But we don't know how to give birth any more than we know how to be a good lover. And let's look at hunger, because that's a driver. You get hungry, you got to eat. But honestly, if we do not know what foods are safe to put in our mouth, we can go from one part of the world to another part of the world, and we have no clue. We have no instinct to know what's going to kill us by putting food in our mouth or what's safe. Nor do we know how to cook, right? We have to learn those skills. We have to learn those skills. And we put a high level of, praise or whatever on people who know how to cook. Us as parents have spent months taking things out of our kids' mouths, so we know it's not instinctive. Some of us, common sense told us to learn how to be a good lover. Yet women, we as women, tell each other giving birth is a physiological thing. You know how to do it. It's not painful. It's just a wave. It's just a rush. No, nothing burger. Rarely requires medical care. Nothing, right? And this is the myths that we as women have passed on and continue to pass on today. I, as the director of the trust, have decided when COVID hit that I, as the director of the trust, have to come forward to try to debunk these myths and to try to reclaim what we could have started when I gave birth in the 70s. We could have, if these 3 obstetricians had said 100% of pregnant women are going to give birth, 100% need skills. We want women to use skills so they do not suffer in childbirth. You can cope with the natural occurring pain. You can manage it. You can work through it. You can deal with it. You can stay on top of it. You can handle it. It's hard work. That's why it's called labor. We all know what hard work is. That's why we develop resiliency and endurance and fortitude and all of those admirable traits, right? So we can do that, and we can do it better when we have a birth coach, a husband or a family member who's going to be in that child's life to share skills. And that's what birthing better is. There are other skills-based methods out there. Choose one of them, for God's sakes, and from 24 weeks on, start to learn skills, write a skills-based birth plan, give it to your birth provider so they know what skills you're using, and tell them, if you look like you're coping and managing, if you're working well through, and we're just still talking about labor, and your partner's working well, praise us. We want to know you admire our hard work. And if we look overwhelmed, look at our notes and encourage us to use the skills. Why do we stop using skills in labor? Because Lamaze and Bradley focused their skills on low-risk women, and when those risks changed, we stopped using skills. When we had more medical assessments, monitoring procedures, we stopped using those skills. That's because the message was that skills don't work for us. These skills do work for us. They help us cope and manage. That's why we need to use them, because there are 2 parts of childbirth. There is suffering, which can be managed by coping and better with skills, and there is the reduction of risks that may become a problem and rarely become a tragedy. Skills can reduce those things as well. But we're not talking really about that now. We are talking about childbirth pain. So we need to have a societal message. You who are listening to this need to put the societal message out. It's a simple one. When you're pregnant, it's just normal and natural self-learned birth and birth coaching skills, and then use those skills to work through the activity of birthing your baby. You don't want to suffer. You want to feel good about your birth. You want to cope and manage. And no, you don't have to like it. Yes, you can be terrified about it, but when you have skills and you apply those skills, you know you're coping and managing it, even though you hate it. But you know you're coping and managing it, and you're building that endurance and that fortitude and that resilience. And as mothers and fathers to be, that is demanded of us as we become parents. Our children expect us to be adults. They expect us to have fortitude and resilience and endurance. We have to do that. If you want to compare this right now, if you want a visual right now, take a look at any mother and father in a war zone holding a screaming child or a starving baby. That adult has resilience. They don't like what is happening. They are using resilience and endurance, persistence, capability. They are coping, managing, dealing with some horrible thing that may not be over in 8 hours or 12 hours or 24 hours. You can do this. You can cope with pain of labor when you have skills. You don't have skills because we as women told you as women, you don't need them. Pain's just a rush. It's just a wave. It's just instinctive. Y'all know how to cope. No, we don't. And as women, we need to do a mea culpa on this one, because this was all illusions from the back end. 100% of pregnant women give birth. Women with high multiple risks can cope well with a natural occurring pain, and their baby can be spit out with no problem. Women who are yoga teachers, who eat well, who think well, never have a fear of pain, don't necessarily cope with labor, and their baby can have difficulty fitting through their tight body, and they can end up with every intervention in the world, or unexpectedly have a problem that ends up with a tragedy. There is no correlation between low risk and outcome or high risk and outcome on an individual basis. So splitting us up as women was a myth to begin with. 100% of pregnant women will give birth one way or another. It's our birth. We get pregnant to have our baby, not a type of birth. So coping with a natural occurring labor pain is easy when we change the societal message. And you're responsible for changing it. Just tell everybody when you're pregnant, it's normal and natural, self-learned birth and birth coaching skills, and then use those skills to work through the activity of birthing your baby. You'll just feel more empowered. You might not like one moment of it, but you'll feel more empowered. And it's better than what we have now, is the shame, blame, guilt, disappointment, and birth trauma, because women have been told since the 80s by the natural birth movement, just make a birth plan. You know what you want for your birth, and they should give you that birth. That's a myth. That's an illusion. Why? Because babies don't come to plan, right? And there's no way to know what your birth's going to be like. So our defense as women, as human beings, absolutely must be to become a skilled birthing population. It's just normal and natural to become skilled. Whether you're high risk, low risk, whatever. It's an activity. All of us do better when we have skills for an activity. We know that. And we know when we're learning skills to do an activity, we feel stupid at first. We're not certain we can apply those skills. But we develop proficiency. And we can't practice labor beforehand, so we have to trust that those skills are applicable. And then when birth unfolds and we apply those skills, it becomes obvious they're applicable, because our job is to cope with the natural and normal occurring labor pains. And we can do that. And once again, we can do it we hate it. We don't have to like it. This idea that when we have more pain, this produces this oxytocin rush, and this allows us to cope with pain. We have to stop as women telling each other that. I have not met any woman in 50 years, there are tens of thousands of them who have said, yeah, I felt that oxytocin rush and then I could cope with the pain better. Never occurred. Never, ever, ever occurred. However, this is an interesting, particularly sideline. A lot of women first birth because their bodies never opened up to this big object. So we have 4 types of tension. We have conscious tension, just tighten up down there now. That's conscious tension. Subconscious tension, when people are walking around like this, they don't know it, right? Or like that, they don't know it. We have it down there as well. We can have a fixed, immobile sacrum. That's subconscious tension. We don't even know we have it. We can have structural tension, so the shape of the hole in our pelvis or the tight muscles in our vagina are structural tension. Or we can have stretching tension. That's when the cervix is being pulled open. That's stretching, and that causes pain. It's like doing a split. It hurts like a mother, right? Or that ring of fire. Hurts, hurts, hurts. So we use breathing, or we use relaxation, or we prepare the vagina, and then that doesn't occur. We prepare inside the vagina. That doesn't occur. Or we create space and mobility in the bones, but we have to know how, and nobody's telling us how. Our trust is, but we're just one of several skills-based methods, right? So when we have skills to do any activity and we master those skills while we're doing that activity, and if that activity is challenging, we feel incredibly empowered. It doesn't mean we have to be perfect. It just means we have to be conscious and be able to adjust and adapt skills that can be sustainable throughout the task that we're doing. We have 50 years of experience of skilled birthing mothers and fathers, families who develop these skills for their births, right? And they tasked me with carrying them forward into the future. Here I am in the future, 50 years later, still knocking my head against the natural birth movement that is saying to you, pregnancy and childbirth are normal life events that rarely require medical care. Pain is just a rush or a wave. You instinctively know how to birth. Don't worry about it. Just plan what you want and be pissed off because they don't give you the birth you want. We are failing. We are failing that. And we have to recoup and reclaim what childbirth is. It's an activity. It's one-off, can't be replayed. It's finite in time. It's life-transforming, and it's infrequent in life. We have to do this. We've just got to do it. You are responsible for this message. I can't do it alone. I've been doing it for 50 years and have been shouted down for 50 years, right? Shouted down. We can't keep doing this to each other as humans. Now, I've ranted and raved about labor pains. Now I'm going to talk about the other pains. So we know the ring of fire, dilation of the cervix, has to do with pain, not connected to a problem. Abruptio of the placenta, rare as hen's teeth. If it happens to you, it happened to you 100%, okay? If you are concerned in labor, particularly you dads, that pain is connected to a problem, ask. And if they say to you, that's normal, get into really helping her cope with pain. Don't assume women know how to birth. There are other pains in childbirth. Most of them are recovery pains from surgeries. They're a nuisance. We feel terrible. But why shouldn't we use skills in a recovery pain? In fact, birthing better families who had non-laboring cesareans prepared their body for birth anyway because physiologically their body's preparing to labor and have a vaginal birth. Their mind knows they're not. And then they use their skills on the way to the hospital, that's their labor, while being prepped, that's their transition, and during the birth because they're working through the activity of birthing their baby. And sometimes epidurals do not work, even in labor, and you still have pain. Duh, have skills, work with it. After cesareans, often women can have pain. It's surgery. So use skills. We have lots of guys who say when they learn these skills, they use them for getting a tattoo or something like that. So there are issues in birth that are connected to a problem. Ask. It's as simple as that. Is this pain connected to a problem? If it is, you have two choices. Do you numb the pain, but the problem is there? Or do you try to solve the problem to prevent it from becoming a tragedy? So that's the next question. Is this pain a problem? And if the answer is yes, then you ask, is the problem going to be reduced by my numbing the pain? Is this problem going to be reduced by dealing with it? Which way are we going? Both or one or the other? If you are in labor and you ask, this pain is excruciating, I feel like I'm going to die. Is that true? No, this is natural occurring pain. Then hopefully you have skills to keep working through it. You can feel like you're going to die. It hurts. You can feel like it's going to go on forever. That's what it feels like. But it doesn't. And then it goes away. So that's pretty much my rant about childbirth pain. You're responsible for passing on this new message, because the previous message that just says birth is a nothing burger, it's just a normal physiological thing, and women just need to be left alone, and midwives and doctors need to sit in the corner and let women discover birth by themselves, and a woman will always get into the best position. No, she won't. She will get in a position that tries to reduce the pain, and then that lingers the labor, because the increased pain is your baby telling you that it can open you up and move down through and out your body. So as your labor progresses and it gets more painful, embrace it, because it's going to be over with soon. So we have to change the message. And we as women have to give a new message. We can't fault the natural birth movement. We can be irritated with people who pass this on because it's not accurate. It's based on imagination. But they've also been great benefits. They've gotten us thinking about this. And now we have to move on. Maybe not for my generation. I'm not going to have more kids. My kids aren't having more kids. But their kids are going to have kids. We want to grow a skilled birthing population for the future. Just as we want to clean up our environment for the future. We need to do this. And we have to do it by having a simple idea. Pregnancy and childbirth are normal life events that may or may not include health issues or other issues. And it's just normal and natural to self-learn birth and birth coaching skills so that we can do this activity of birthing our baby in all circumstances. That's what we need to pass on. That's what needs to catch on. That's what needs to go viral. And we need you to help us do that. Because obviously, 50 years later, I've been ineffective. So there you go. I'll talk to you another day. Bye-bye.